Welcome back to all of my subscribers. If you're new to this channel and to the podcast, welcome to This is Getting Old, Moving Towards an Age-Friendly World. I'm Dr. Melissa Batchelor, and I am a nurse and a nurse practitioner with nearly 30 years of experience caring for older adults and their families. Now, one quick question before we continue. Have you joined my university to help you learn about all things you need to know to age wisely? It's called AgeWise U, and it's an exclusive membership community where you'll receive expert insights, resources, and support to navigate aging and caregiving with confidence in one organized place. So if you have questions about aging well or need practical strategies for being a caregiver for a person living with Alzheimer's disease or related dementia, you can sign up today at MelissaBPhD.com, start learning, and find the support that you need today. And while it's actually hard for me to believe, March of 2025 is the 5-year anniversary of the podcast. And looking back now, and this wasn't even planned, but my very first podcast episode was with Dr. Terry Fulmer, who's the president of the Johnny Hartford Foundation, which is one of the major philanthropic organizations who share my life's mission to improve the quality of care delivered to older adults in America. And in March of 2020, on that very first episode, Dr. Fulmer shared the Age-Friendly Health Systems 4M's framework. And they were about 3 years into rolling this out in hospital settings. And today's episode will catch you up on how this initiative has actually finally spread into nursing homes. And the reason I wanted to focus on this topic today is because the mission of my entire career in nursing has also been to improve care for older adults, and in particular for older adults living in nursing homes. I've also been part of the National and State Advisory Board for the Nursing Home Collaborative since it started, and with the work they've been doing, which is absolutely amazing, and it's been transforming nursing home care. So I wanted to share all of this with you. What if the key to better nursing home care wasn't just more staff, but smarter training, stronger partnerships, and a fresh approach to education? Today, we're going to be diving into an innovative model of care that is reshaping long-term care, and it's called the Teaching Nursing Home Collaborative. And this program connects nursing homes with schools of nursing to give staff better training, to help nursing students learn, and to improve the quality of life for residents. It started in Pennsylvania, but now it's rolling out nationally. And joining me today are 3 key players for the Teaching Nursing Home Collaborative: Nancy Zionts, Kim Ratliff, and Taylor McMahon. And these are 3 amazing individuals who are going to share how this model is making a big difference in tackling the challenges faced by the long-term care workforce and paving the way for better nursing home care in all states. So stay with us. You won't want to miss this conversation. What if the key to better nursing home care wasn't just more staff, but smarter training, stronger partnerships, and a fresh approach to education? Today, we're diving into an innovative model that's reshaping long-term care, and it's called the Teaching Nursing Home Collaborative. And this program connects nursing homes with schools of nursing to give staff better training, to help nursing students learn, and to improve the quality of life for their residents. And it started in Pennsylvania, but now it's rolling out nationally. So joining me today are 3 key players for the Teaching Nursing Home Collaborative: Nancy Zionts, Kim Ratliff, and Taylor McMahon. And these are amazing individuals who are going to share how this model is making a really big difference in tackling the challenges that are faced by the long-term care workforce and paving the way for better nursing home care in all states. So stay with us because you won't want to miss this conversation. So now let's dive into the Teaching Nursing Home Collaborative. So before we begin, I'll let you guys introduce yourselves and tell us how you kind of got into working on this project.
I'm Nancy Zionts. I'm the Chief Program and Strategy Officer of the Jewish Healthcare Foundation in Pittsburgh. And I got involved in this together with the Johnny Hartford Foundation because we were sitting there in 2020 watching as COVID ravaged nursing homes in Pennsylvania and beyond. And we said there has to be a better way to help rebuild the workforce, to rebuild the skills within nursing facilities, to ultimately help the workforce as well as the residents of skilled nursing. And 2 foundations got together, brought in a few others, and we were off to the races.
And Kim?
Hi, I'm Kim Ratliff. I'm the Director of Nursing. Oops. I'm the Director of Nursing at Wesleyan Enhanced Living Mainline. We got involved because we were invited, and it looked like a great project. I had worked with Nancy Zionts through another webinars during the pandemic, and we were invited to be part of this. And I thought something good had to come out of the devastation of COVID. And if I could be a part of that and my facility could be a part of that, we were all in.
And then Taylor.
I'm Taylor McMahon. I'm the Director of Nursing at the Willows, the Presbyterian Senior Care Network. I was so grateful for this opportunity to be a part of this collaborative. It really tackled two key elements that as part of that rebuilding effort throughout the pandemic and still stays true to this day, which is creating a new workforce and creating that pipeline of registered nurses to come into long-term care, as well as improve quality of care with age-friendly health systems. So we are so grateful, and the benefits of being a part of this collaborative are endless. So thank you.
I appreciate all of you being with me today. So before we get started, if for someone who's not familiar with the Teaching Nursing Home Collaborative, Nancy, maybe you can just give us an overview of the collaborative and its mission.
Perfect. So the collaborative was started as a pilot project between 2021 and 2023, and we are trying to test a model from the 1980s of what could you achieve if you brought together schools of nursing and nursing homes, both on the side of improving the workforce, as Taylor mentioned, and improving quality of care for residents by introducing the framework of age-friendly health systems into nursing homes. We tested it with 3 universities within Pennsylvania, 3 different regions, and 4 nursing home partners. We tested that for 2 years. We were so excited by what we saw in terms of just revitalizing the interest in going into nursing homes and giving those workers who were in nursing homes a sense of something new, as Kim mentioned. We're coming out of COVID, although let's be clear, COVID is still in nursing homes and elsewhere. We're coming out of COVID, but how do we give people a new way to frame things? So we're a collaborative, which means it's all teach, all learn. So everything that we do is intended to provide resources and tools that can be shared across nursing homes, across schools of nursing. And our goal is just to make those relationships and those dyads better, but also to make the relationships among nursing homes across the Commonwealth of Pennsylvania better. They can learn from each other. We can each learn from each other. It is a true collaborative. It's a delight.
Right. And I was excited about it because I know as a new nurse coming out of nursing school, I was the director of nursing within 2 months of having my nursing license. And I was like, I feel like I'm all alone. Like, how are we supposed to learn? So I think that is, really the biggest thing is helping to connect people working in nursing homes with other people, as well as, schools of nursing. So what are some of well, I guess we'll start with Kim and Taylor, as directors of nursing in a nursing home, with all the other challenges that you were facing. Why did you decide to participate in this program?
Well, I think it was twofold. First, we recognized the need for more nurses. We had lost a lot of nurses, retired during COVID. So we knew we were going to need more nurses. Filling the positions we had was very difficult, and we knew it was going to be a problem long term. So getting involved with schools of nursing, although you may not reap the benefits immediately, because of course, well, they're number one, they're in school, and number two, they all want to work in peds or ICU, but down the road, they may very well see nursing homes as an option in their life. So that was one reason. The second reason was we wanted to do something new and really focus on our residents and making their lives better. And adopting the age-friendly health system, I believe, has been instrumental in making our residents happier. And it's not just a nursing project. It's I would even venture to say it's more activities and social work project. It really involves the interdisciplinary team and focusing on what matters to them and their mobility, their medications, and their mentation has enhanced their lives. And again, our activity program has expanded amazingly, involving making special recipes for our residents that the residents really enjoy, that for one resident, but everyone can share it. And our residents are a lot happier now that we focus on just them and what they want.
And same question for you, Taylor.
Yeah, I definitely agree with Kim. This has really this initiative, this collaboration has really re-energized our team for both of those reasons. So there is a stigma about nursing homes, right? In nursing school, I remember being in nursing school and having very little exposure to nursing homes. And, we really wanted to change that to show the next generation of nurses that this is just specialty of care, just as important as pediatrics or ICU or ER, that you can build meaningful relationships with older adults. You have a lot of autonomy. You're able to build those relationships and improve quality of care for geriatric residents and patients. And so it really is inspiring to me when I see nurses and nursing students see what I see in long-term care, which is building those relationships and promoting a quality of life. So that was really, and I actually hired one of our students from Pitt Nursing that came in and fell in love with working in the nursing home, and she is an incredible asset to our team, and she graduates next month. So we're just thrilled. The second part of that is at Presbyterian Senior Care Network, we pride ourselves on being person-centered. It's in our mission. It's who we are as a network. This really defines it. It's so much more than allowing a resident to choose what they wear for the day or what time they want their medications or what activities they want to attend. It's really about empowering them and encouraging them to be an active participant in their healthcare because it looks at the resident holistically. So what matters is always number one, and then medication, mentation, and mobility really align with what matters most. So we have countless stories and testimonials from our residents saying that this does improve their quality of care. And also from the nursing students that this has changed their perception of nursing homes, which is ultimately the goal of all of us on the collaborative.
Mm-hmm.
Right. And that's actually why I ended up leaving clinical practice and going into academics, was to reach and teach nurses at the beginning of their career best practices and to show them that this is an exciting and a viable career path. And most schools of nursing don't even have one faculty member prepared in geriatrics. So I think it's probably a two-way street, educating, faculty about the opportunities that nursing homes bring. And it's interesting how some of the even the policy work around staffing for nursing homes is making its way into the news. I was listening to my local news last night, and they actually mentioned the legislation in Congress right now to make sure that all nursing homes in the United States have at least one registered nurse on at work 24/7, because right now the requirement is just 8 hours a day. And I think that's another misconception, but also kind of another side little bunny trail we don't necessarily need to go down.
It's skilled nursing. Skilled is in the name, right? Nursing is in the name. And we really need to make sure, I think that was part of our motivation. How can we continue to support bringing and supporting the skill that is in nursing homes? That was our motivation for getting involved in this project.
As the population of geriatric people in America is rapidly growing, what can be, what can we do now to prepare for that? And which is bringing more nurses into long-term care.
So now let's talk about what have been some of the biggest challenges in integrating academic training with nursing home care.
I'll start. I had an aha moment at the PADANA conference. That's the Pennsylvania Director of Nursing Administration Conference. And I remember the first time I went to present on this project. And so I had a room full of nursing home DONs and people who worked in the nursing home. And I asked what was, of course, a naive question: how many of you have partnerships with your schools of nursing? And every hand in the room went up. And I thought, oh, I wasn't expecting that, because I had heard that there were. So then I asked the follow-up question: how many of you are satisfied with the relationships between the nursing home and the School of Nursing? And a lot of those hands went down. So part of the challenge that we realized early on was that the motivations of those two parties were not aligned. So the nursing homes do not know how to say no, and they are looking for a workforce of the future. So if you want to send someone into their nursing home to spend a day, to spend a week, to do a project, they're going to say yes because they see the ultimate hook. But if you ask the School of Nursing what they want, they haven't really connected on that customer-supplier relationship. So sometimes you have people going into the nursing homes, it's their first week in School of Nursing or their first semester. They've learned nothing about the geriatric population. They've learned nothing about what that environment is like. And so they come in and they are not only not helpful to the nursing home, they can be a detriment in the nursing home. So how could we create those better relationships so that people knew in advance not only what they were going to see and get when they went into a nursing home placement, but that nursing homes could have a little bit of a balanced power dynamic and be able to say it would be really helpful if they had a course in body mechanics before they came here, if they had been HIPAA trained before they came here, whatever the case may be, but being able to negotiate those preconditions for a really successful placement as seen by both parties. So the challenges, I think, were they really didn't know each other and they didn't communicate very well and they had different incentives. And I think this project has helped them to work on a more even playing field. That's my impression. You guys can correct me.
I think Nancy's right. We had before the pandemic and before this project, we had worked with mostly LPN programs and CNA programs, and it was more them coming here to get their clinical. When we joined this collaborative and worked with Penn, it was more, what can we do for each other? So it had a different approach. One challenge that we faced was what the CNAs were a little intimidated working with RN students. But we told that, they had more experience actually than the students that were coming. And we reassured them that they have a lot to offer RN students and they needed to learn. I mean, these nurses are eventually going to work with them. Or someone in their position, and they needed to learn their job too. So once we got over that little hurdle, we as a nursing home weren't used to asking anything of the students other than to take care of the residents. But because we were both working on age friendly and learning about that as well, they were able to do some projects for us, which resulted, they would interview the residents, which helps their communication skills and interviewing skills and some assessment. They filled out forms about the residents. What about me? And then our medical records person received these to go in the resident's chart, and she says, oh, I can make a poster out of that. And so she did. And now those posters are hanging in the resident rooms about the resident. So you can go into any resident room of our long-term care residents and you can know that they liked MASH or they love dogs or, they have 4 grandchildren. So you have a conversation starter for them. So it really was more give and take. And then we were given the opportunity to meet with those students and talk to them. It's also helped us reform our relationships with the other schools that were coming here. So we could, we felt more comfortable or had a better knowledge of what we could ask from them. And then they, in turn, have given us teaching opportunities for their students. So now I go and talk to every graduating class of the LPN school about age-friendly healthcare, because hopefully they'll be learning about that in the nursing homes that they might go to.
And Taylor, you kind of mentioned on this, but I'll ask you a slightly different question. How's this initiative impacted your workforce development, and in particular, attracting and retaining skilled, nursing professionals?
So I have the opportunity every semester to go into Pitt Nursing and present on neurocognitive delirium. And I'm able to really go off of the content that they're learning in class, but also throw in those stories about we had a patient admitted to our skilled floor with tested positive on the UB2 and the CAM for delirium. And these are the non-pharmacological interventions that we put in place. And this patient, the delirium resolved, patient discharged to a lower level of care. So I'm able to really build in those stories when I'm talking to the students. And I ask them, you know, what is your impression of nursing homes? What are some of the stigmas you've heard? And I'm able to start to break down those barriers by talking to these, you know, these students in a more advanced course than their first semester. So junior 4-year students. Also, I had the opportunity to co-design the for our clinicals that we have PIT nursing students come in to do in the nursing home. Co-design, what does that look like for the student? So each week we pick an M, and I'm able to say, okay, this week is mentation. You're gonna go with the social worker and do a MOCA, or let's look at the BIM score. Let's look at the PHQ-9 depression score. This resident's identifying as depressed. What do we have in place to combat that or to make them feel more at ease? It's so much more than giving them a Zoloft, right? It's going beyond that, and really looking at the resident individually. You know, a lot of these things are regulatory, and we've never really expanded on them. Now, when we're meeting on quality, and a student was able to shadow just last week, a PIT nursing student during our quality rounds, where a category right beside antipsychotic utilization, falls, you know, whether they're elopement risk, right next to it is what matters most. That was added in with this, you know, so the student's able to see, wow, it's not just a checkbox. They're talking about this every week, about every resident, to try to improve the quality of life or quality of care. And these students have beautiful presentations at the end of their course that they share with each other. They share with us, and it's a case study on the 4 M's on a resident. So they are really able to do a deep dive into that resident's plan of care, which we're thrilled. We have one in a week or two. If anybody, I think actually 2 weeks, our student will be presenting on her case study at the Willows, and that recording will be probably on our website, I'm sure, for Teaching Nursing Home, which I'm sure Nancy will touch on later on.
Yeah, I mean, so I do think that there is still a stigma around working in nursing homes, but it's amazing how those perspectives can be shifted just by having a positive interaction with the long-term care, you know, setting and with the staff that are there. I've always told my students, was like, I can't imagine working in a hospital where every 3 days people turn over and you don't even get to establish a relationship. You don't know that person. And, you know, I do think it is the beauty of, you know, skilled nursing care is that you have time to develop those relationships, and that often changes people's minds about working in that environment.
One of the other things that we've seen that can change the minds of nurses is if you go into a very large health system, you have so many layers between you as the new nurse and any kind of level of authority or responsibility. You're starting here. When you go into a nursing home, there is no here to there. It's here to here. You know, everybody is involved in everything. It is the team nature of what happens. You are front and center with the resident, and your interactions with that resident and your knowledge of that resident feeds right into the rest of what happens with them. So you're really getting much closer to the action and to responsibility and authority much sooner. It's not a 10-year journey. It can be a 1 or 2 year journey to really get yourself into a position of leadership. And Taylor's done a remarkable job taking CNAs and other nurses and building career paths for them within their workforce.
Right. So I think my next question is going to be, you know, how do we see the teaching nursing home model evolving in the future?
So is that me?
Or
So
anybody?
the goal of phase 1 was to test it, and the goal of phase 2 was a little ambitious, and that is to reach all 600 plus nursing homes in Pennsylvania and all 40 or so schools of nursing. I'm pleased to say reaching them is not the overwhelming challenge we thought it would be. Engaging them is something different altogether. So we've been able to pull in some resources within Pennsylvania that I think other states can look at what similar resources they have. So the Jewish Healthcare Foundation, in addition to running this project, runs the Pennsylvania Long-Term Care Learning Network, which is from 2 o'clock to 3 o'clock every Thursday. All of the nursing homes within Pennsylvania that are funded through the Department of Human Services, which is most of them, the Medicaid department, all of them are able to come and get education and training. And it is tied into the quality incentive program. So there's a carrot stick. They have to show up sometime during the year in order for them to qualify for their financial incentive, which comes through the managed care organizations in the state. It's kind of a nice tying in them all in together. And this quarter, we have taken 9 of those sessions, the whole quarter, and we've turned them over to age-friendly health systems. So we are training hundreds of nursing homes this quarter in Pennsylvania on the 4Ms and bringing in incredible case studies from around the Commonwealth and from around the country to get people deeply involved in age-friendly health systems. So that's a way of sustainability, because that long-term care learning network is long-term within Pennsylvania. It's built into the managed care contracts. And secondarily, it's built into something through the Department of Health. They have the PA RISE program, which is all about teaching resilience and extra skills to our nursing home within Pennsylvania. And they have adopted age-friendly health systems as one of their visions and goals for the last few years. So they are helping with implementation on the ground. So the idea is, if we can, over the next year and a half of this project, get all of the nursing homes engaged, then they will have started on a journey that has a lot of support from IHI and from others to keep them pushing through. And for the schools of nursing, as hard as it is to make changes at the schools of nursing in terms of curriculum or in terms of placements, once they make them, they are really solidified within those institutions. So it's been worth the investment of time and effort to get the deans involved, to develop new faculty within these schools of nursing, because that will be the long-term sustainability in the schools.
Very true. Anything to add, Kim or Taylor?
Yeah, I feel like the schools of nursing are moving toward adopting this, and Nancy's right. Getting the nursing homes, everybody feels so busy, and I'm trying to convince my sister nursing homes and others that it is worth the time and investment, and they can start slow. You can start, very slow. Some of the facilities that we've worked with went slower than we did. So it's okay as long as you try to just get one area and moving that direction. It can improve the lives of the residents and the staff.
Yeah, that's kind of a basic tenet of geriatrics. Start slow and go, but just go.
Oh, right.
So if someone was interested in learning more about this or wanted to support it, how could policymakers or other healthcare leaders or even the public help to support expansion of this initiative?
Well, we are welcome the engagement of policy leaders. We do have a policy arm for this as well. So we have a group across Pennsylvania, non-competitive, for-profits, nonprofits, unions, policymakers, providers, advocates, that are working on some of the issues of what is this struggle of getting the workforce identified, supported, trained, credentialed, getting them with good placement. So we are finding those glitches that one by one nursing homes thought it was just them. Well, we can't find a certification slot for this person, or we can't get them to sit for an exam. We find out it's a systems problem. Well, once you find out it's a systems problem, you can come up with a system solution. So we welcome the involvement of policymakers, whether they're in Pennsylvania or in other states, because as we can identify these glitches, we can help to fix them. But anybody can get involved and learn more about this. All of the stuff we've talked about is free, in the domain of free, because it's been paid for by Jewish Healthcare Foundation, John A. Hartford Foundation, Henry L. Hillman Foundation, Independence Foundation. And so you can go to PATNHC, the Pennsylvania Teaching Nursing Home Collaborative, just those initials, PATNHC.org. And you can get in there, and all you have to do is fill out a join it form that says, I want to know more. We will then envelop you with resources and opportunities to get involved and get engaged, whether you're someone from an academic institution, from government, from a healthcare system, from an MCO, we welcome you. You don't have to be from Pennsylvania. We have people from 6 or 7 other states also engaged as we try to figure out, watch one, do one, teach one. We're trying to take this across the Commonwealth of Pennsylvania and then take it out to the rest of the country. So we encourage people to get involved. Most of you who are listening to this have something to add to this project, not just to take from this project. So we're self-interested in getting you to fill out a join it form. We'd love to have you come along.
Right. Well,
Can I just add one thing? I
Yes.
just want to add, it is not a once and done project. It's not something you can say, yes, I've done that and move on. It is a continuing learning process. I have been in the teaching nursing home project collaboration since the beginning, but I still attend all of the webinars because I always pick up something and say, I didn't think of that. And then I can go do it. There's always things that spark your interests, things that spark your imagination that you can do. So it's an evolution, which in the end benefits the residents and the staff. So it's and when the state comes and does their visit, they walk around, they don't get any ideas because the residents are happy and the residents want to extend their resident council to tell them about things that we do for them. So it just makes the whole atmosphere so much better.
Anything else to add, Taylor?
Yeah, just to echo what Nancy said, we welcome anybody to join us. This is a movement. This is it's evidence-based. It's meant for no harm, right? And I know I can speak on behalf of Nancy and Kim. We will welcome you to, I know our contact information is on here. Email us, ask us questions. Happy to share what we've learned, and really would love anybody to join us on this incredibly important mission to connect nursing homes to schools of nursing and continue to evolve age-friendly health systems, which is designed, and I can speak from experience. I know Kim said we're all busy, but it's designed to be very little burden. It's integrated into the work you're already doing, and happy to share our story with anybody willing to connect with us. So go on the website, fill out the join us form, and Nancy's team's amazing. They will connect you to Kim or I if we can be of any of assistance on your journey.
I'd like to add also, we're talking a lot about nursing, but nursing homes have more than just nurses, as we've mentioned once or twice before. So if you're listening to this and you're a medical director or you're a clinical lead or you're a pharmacist or you're an activities person or a therapist, this work matters to have you involved in this as well. So this is a whole house sort of thing. And the more people we can get involved, whole house, the more disciplines that can bring their insights into this work, the better off the residents will be and the happier overall the overall staff team will be.
Right. And, I know locally here, in Wilmington, I've put our School of Nursing in touch with you and a local nursing home corporation. So what other states are you actively in now?
Oh, I knew you would ask that. So a lot of them start with an M. So I'm going to go with Massachusetts, Minnesota. These are states that have contacted us. I want to say Iowa, but we've had a number of states that have come forward and they're getting involved in different ways. So some of them are very deep in age-friendly health systems. And so they're coming in through that door. Others have their schools of nursing that are looking at ways to improve those relationships. It's open to all states, and we can learn from each state because I hate to say it, we each do it a lot the same and a lot differently. So we're going to have to learn what are some of the best practices that we can bring to others. And one of the other things, you're talking to 3, I don't know if Melissa, if you were on this book, but at least 3 of us were authors on this first textbook, all of us.
All of us have a chapter.
We were all authors on this first textbook for frontline workers in nursing homes. That came out of this work when we all looked around and realized, but when you talk about sustainability, is there a leave behind for people? So we've developed guides and they're all available on our website. We have developed toolkits. They're all available on our website. How to get started, all available on our website, and access to resources that you can use going forward. everybody's journey will be different and everybody will start at a different place, but at least we should all have access to similar resources developed by people in the field who are doing this work. So.
Mhm.
Okay, well, we'll be sure to include the website information and the book that you just showed from Sigma Theta Tau International. We'll link those in the show notes, as well as your contact information in case people have questions. But thank you all so much for being here with me. And
What a pleasure.
yep,
Thank
and
you.
I'm excited to see this roll out nationally.
Thank you, Melissa.
Thank you.
Thank you so much.
So thank you so much for joining me today. If you found value in this episode, please hit the like button and share it with someone else that will find it helpful. You can also hit the subscribe button and turn on your notifications so that you're alerted when the next episode comes out, which is usually every Tuesday around 11 a.m. Eastern Time. And just wanted to remind you, if you'd like to be part of my community and continue to learn more about aging, age-friendly initiatives, and Alzheimer's disease, don't forget to stop by my website at MelissaBPhD.com to grab your free podcast insider guide. And you can also join the podcast private community on Facebook, and those links are in the podcast insider guide. And in doing that, all podcast insiders are invited by email each week to join me for the live podcast recordings. We had one person pop in today, but before I could say hi on air with you guys, they had to leave. But anyways, you're always invited to join me to ask questions, leave comments for my guests. So be sure you stop by and grab your free podcast insider guide at MelissaBPhD.com, and then keep an eye on your inbox weekly for the special insider only invitations. So until next time, be well.